Well, thanks everybody. I'm Dr. Lamb. I'm the program director at Mary Free Bed Rehab Hospital. I'm joined tonight by several of our residents and Sarah Thompson, our program coordinator, and Dr. Bridget Reisig, our associate program director. I'll kind of let her get started with some of the program overview and then I'll jump in a little bit. So take it away, Dr. Reisig.
Sure thing. Thank you so much, Dr. Lamb. Like he said, my name is Bridget Reisig. I'm the Associate Program Director at Mary Free Bed. This is my third year in this role, and I like to start our discussion about Mary Free Bed by talking about our name. I feel kind of compelled and obliged, but also excited and proud to tell this story because I think it tells a lot about not just our history, who we were, but who we are today, and not just our name, but our identity beyond this. So, our hospital was started in 1891 by a group of kind of pioneering women who initiated a fund for those who couldn't afford healthcare in West Michigan. They began by just passing around a little purse, collecting spare change from women named Mary or the loved ones of women named Mary, their circles, and just asked, contribute a dime, with the goal of financing a single Mary Free bed. And while this originally was an acute care hospital bed, it transitioned later from acute care to rehabilitative care in 1911. Early on, it specialized in pediatric orthopedic rehab and then expanded to the adult population in the 50s and 60s. And since then has just exponentially grown many times over. But we maintain ties to our humble roots and are still actually led by a group of women leaders today in homage to the women who have built out from this single bed. Now, the one of the largest not-for-profit rehab hospitals in the nation. And yeah, we still are run by this guild of women. I feel particularly proud to tell that story because I think it's rather unique and tells a lot about who we are. So looking more closely at who Mary Free Bed is today, like I said, the largest not-for-profit rehab network in Michigan. We have just about 140 acute rehab beds on our main campus, as well as 48 subacute rehab beds. And then also this collection of acute rehab beds across the state and extending into the other areas of the Midwest. And so what that means for me as an attending is that I have colleagues, partners, resources all across the region. It really has increased access for people, not just down the street, but all across the region to the highest level of rehab opportunities around. And what that means for the trainee is that you would be exposed to a wide breadth of patient populations, conditions, case mixes, from really the most mild to the most severe, outpatient, inpatient, a variety of diagnoses from patients on day 0 of injury at our level 1 trauma center and day 100 from down the street or across the country. And this diversity of experience is something we really pride ourselves on for our residents, because it means that when you graduate, you're prepared for any iteration of rehab directly out of residency, whether you want to enter practice or match into a competitive fellowship. Our graduates have been prepared to do it all, and I think can start each day quite comfortable and confident that whatever comes in the day today, I've seen it before, done this before, I'm ready for it. And that is such a nice way to start your practice as an attending. Zooming in on our main campus, you can catch glimpses here of some of the specialty services that we offer from both our aquatic center and then also That's a snapshot of our prosthetics and orthotics fabrication lab. And it's all right there on site so that you can be part of the real time resources for both inpatients and outpatients at Mary Free Bed. We've become sort of a one-stop shop for rehab in every phase. Another arm or extension of Mary Free Bed in our mission locally is the Mary Free Bed YMCA, which is the first of its kind in terms of accessibility. And it was designed with this commitment to serving all people with all sorts of needs. And I think also serves then as a reminder and representation of just how much Mary Free Bed is part of the community, right? Not just for the patients within the complex of Mary Free Bed, but even beyond those walls and out into West Michigan. And I would be remiss not to highlight our brand new pediatric hospital, which is, literally being built as we speak with the hopes of opening officially in the next year-ish. And it's built with our partners at Helen DeVos Children's Hospital, and it will greatly expand our current pediatric unit and will be one of just a handful of freestanding pediatric rehab hospitals in the country. So very exciting time for our program and for the West Michigan community. Here, I will pass it over to Dr. Lamb to give you more details about the residency.
Sure. Thanks, Dr. Isaac. So just some nuts and bolts, because I think this is always kind of a nice overview of kind of what your years in training would look like. As with most programs, we start the majority of our training inpatient. So we have about 9 inpatient blocks as a PGY2, 4 as a PGY3, and 1 is PGY4. And so you can kind of see that there's an increase in outpatient services as well from 4 to 7 to 8. As well as a total of 6 elective blocks, which is the maximum allowable under the ACGME. And so that kind of gives you some flexibility if you're wanting to get more experience, particularly in fellowships. You can go back and repeat a rotation again. You can participate in an away rotation as well. So really just trying to customize your learning to what would be best for you. We kind of weave EMG education and didactics as well as rotations through a lot of kind of longitudinal experiences, because I think that results in a little bit better knowledge retention than kind of having a solid dedicated EMG block. Our didactics participate on a 12-month rolling basis. We've kind of experimented with 12 versus 18, kind of looking at that, but we feel like this gives the right amount of repeat of material for retention, but also with the recognition that people may be away or on vacation. And so if you're on an 18-month block, it's a lot easier to miss the same lecture twice. We're currently in our anatomy block this fall at Michigan State College of Human Medicine Anatomy Lab, working with prosected cadavers. And we also partnership with industry where it makes sense for us. And I think that for us is a really important part. So whether it's additional injection or hands-on anatomy experience, toxin reconstruction, backflow and pump management, all of those types of things. Some unique attributes. So not necessarily unique to Mary Free Bed, but our residents take home call. It averages out to about 1 or so weeknight per week and about 1 weekend per month as a PGY2, give or take, and then kind of gradually decreases with training, as I think most programs do. One of the unique things about us is, despite being a relatively large rehab hospital, we have an in-house internal medicine service. So there's always an APP, nurse practitioner, or PA in-house in the evenings. And so for our medical group patients, kind of the medical related issues, high blood pressure, hypoglycemia, those types of things are designed to go to the APP first, which manages the call volume. If it's something physiatry related, those are the things that our residents are managing overnight. So we've had good results with that in terms of call volume management. We think, I'd like to say that we think that transparency and leadership is something that we strive for, because I think change can be really hard at any time, but I think especially in training. And so I really try to, where I can, treat our resident team as junior colleagues, take their feedback to heart. Our residents have given suggestions that have created new initiatives or quality improvement projects. And I always feel like my goal as program director in a lot of ways is to try to make the residency program work better for residents. And I think that's, sounds a little kind of like one of those Yogi Berra sayings, but I think it's an important thing. From a mentorship perspective, all of our residents get paired formally with a faculty mentor early in their PGY2 year with the goal of helping to create a resident portfolio kind of centered around patient care, scholarly work, education, committee membership. That same process will follow you the rest of your life. For anyone interested in academic physiatry, that's kind of the core of academic promotion from instructor to assistant professor to associate professor and so on. And so the goal of this is to try to start building some long-term career habits early. We're actually working to expand that same model to our faculty as well this year as kind of an expansion of that QI project. I would say too, a lot of our residents also have more informal mentors kind of in their specialties of choice, be it brain injury rehab, cancer rehab, interventional spine, you name it. So I think it's not just about having your formal mentor, but really about building your mentor village. And I think that's another one of those kind of lifelong career ideas to start early. We have some core faculty who have dedicated academic time, Dr. Beddoes and Josephson working on dedicated EMG instruction and curriculum. Dr. Josephson's also our musculoskeletal ultrasound guru. Dr. Kaplan's kind of uniquely trained as a palliative care fellowship trained physiatrist, and so she'll be working on some difficult conversations, curriculum, also working with our medical student clerkship over time. Dr. Vandenberg is our morbidity mortality kind of QI guru. He's also our IT guy on the physician side. So we go to him with all of our questions about EMR. He's big on integration of AI into medical records as it makes sense. And then Dr. Yablon working on research mentorship and kind of identifying and assisting with some resident-led research projects. So, kind of for those who may not be too familiar with Grand Rapids, we're known as Beer City, USA. This is one of the birthplaces of the craft brewing movement in the United States. We have more than 80 craft breweries and cideries within the Grand Rapids area, and that kind of helps feed a good restaurant scene growing downtown. We're just kind of getting into and through Art Prize, which is a kind of a really exciting art venue that takes place in local businesses, art museums, even out in the streets and sometimes in the river, as you can see here, and a really great Broadway touring scene as well. Getting outside of the city, there's a lot of great weekend or day trips. The top photos on the top right are Traverse City and Mackinac Island. Those are great kind of long weekend trips. Grand Haven, and Saugatuck are about an hour away, so those are good kind of weekend trips. Upper Peninsula for hiking, camping, mountain biking, those types of things. Detroit has all the big sports major league teams, and then it's not Vail or Park City, but Thompsonville up in the north of the state has some surprisingly good skiing for Michigan. And so with that, we've got a couple minutes left that we'll kind of open up for questions. We have our resident team online as well. So if there's more questions from kind of a day-to-day resident life, feel free to join in and ask them questions or ask us questions. So just leave the last couple minutes for that. Hopefully enough time for that. And if you need anything, get in touch with us. And also I'll throw something into the chat as well. While we've got our resident on, not to put anybody on the spot, but if there's any kind of unique things that you felt like you wanted to kind of highlight about our program that maybe we didn't touch on, please feel free to chime in.
Do you want to start, Michelle, or you want me to?
I knew you were gonna say that. You go. You start.
Okay, I'll go first, and then you chime in.
Okay.
Okay. Something really unique. Gosh, it's kind of hard to sum up like 3 years into like 2 minutes, but I think that one of the things that keeps getting addressed over and over again about Mary Free Bed is the culture. I think that being in a standalone rehab hospital is very unique because we are truly focused on the patient's function and outcomes and well-being. And That is a shared commonality among like everyone that you see walking around in the hallway. And I think when we all have that shared goal, it becomes a lot easier to achieve that as a team. I just had a patient today, actually. He was just raving about how positive everybody was. And he said that everyone that comes into his room is super happy, like really happy to be at work. And he said that that energy just spills onto him and his family. And so that was really, really sweet to hear. And that's just something that I keep hearing over and over and over again. And I mean, I have to agree. Like, I love coming to work in this environment. It's truly it's a pleasure.
I agree fully.
Mhm.
One really cool thing about Mary Free Bed is how collaborative everyone is. Just this morning, we had a lecture from occupational therapy about vision and prism lenses and things like that. And they really do want all of us to work together, and we really do all work together, not just like in the resident room, but amongst all the specialties. It's very fun.
Looked like we just got a question in the chat if you could speak about kind of some of the elective experiences that maybe one or both of you chose.
Yeah, so there's a lot of electives to choose from, and I think that the reason for that is that we are plugged into all of the hospital facilities in Grand Rapids. And so we have access to doctors who work at Trinity Health, which is a hospital that's connected to our hospital. Corewell is another big facility that we work with, U of M Health West. And so even if we don't have a specific elective at Mary Free Bed, like you can drive 10, 15 minutes and go do like a sports med rotation with our Corewell docs. You can even go to East Lansing. We partner with Michigan State University in East Lansing, and you can do a EMG rotation over there. You can do a sports medicine rotation. So really the sky is the limit as far as electives. I don't know, Michelle, if you want to get into any like specifics that we're able to do.
I feel like if we don't have an elective set up, then our team, especially Sarah, will do everything she can to set it up. Like I really wanted to do a long-term acute care rotation, and there's one in town. So we're still working on that, but it's definitely moving along further than it was a couple months ago. And that's awesome. I think it's going to be an awesome rotation. And yeah, I love how we have an opportunity to do mostly anything we want to do with regards to electives.
I know we have a couple other questions rolling through the chat. Do we have time? I know it's 8:25.
We only have two programs presenting today, so I think we can allot a little extra time for you guys.
Okay, let's do this, guys. So let's see. This person is asking, do we typically accept IMGs in the program? And then the ECFMG certification timeline.
I tried to answer that one down in the chat. So we have matched
Okay.
several IMGs to our program, typically US IMGs. We don't anticipate a lack of initial ECFMG certification impact review by the 24th. And then the other was about kind of travel, how many kind of rotations are in kind of the Grand Rapids area versus how much kind of with Mary Free Bed Network being across the state, how much are you driving across the state versus staying kind of here locally in the Grand Rapids area for outpatient?
Yeah, most of them are local. There's like a couple of rotations 1 day a week over in Lansing, which is an hour drive. And then you have the opportunity to do electives at other sites as well, like in Muskegon. You can do an extra rotation in Lansing if you want to, but everything is honestly within a 15-mile radius of the hospital otherwise.
All right. Thank you so much for presenting and answering all of those questions. Just want to point out to anyone who didn't see it that Sarah put in the chat their email. So if you guys have any concluding remarks or anything else, and then we'll move on to the next program.
Thanks for having us.
Thank you
so
so
much.
much.
Thanks.